Hello everyone. Today I'm going to discuss about the one of the important topic in the surgery, that is a traumatic brain injury. So in this topic, I'm going to discuss about the learning objectives. What is the traumatic brain injury definition? The incidence, risk population, causes, mechanisms, and classification of head injury, types of the brain injuries, investigations, and treatments. So these are going to cover in this topic. So first I'm going to discuss about what is the brain injury, traumatic brain injury. If any trauma, any accident, or any injury to the brain, or any skull or scalp in the our head regions, any part is there, the outer side is any injury to the skull, that is if any scalp or maybe any skull or any brain injury, so that is also that is called as a head injury. So these injuries can range from the minor scalp laceration to the serious brain injury. Lacerations means only breakdown of any skin cut or damage to the scalp, or until to the is any severe damage to the brain. So these are the different types of the brain injuries or head injuries we can see. So what is the incidence? How often is going to be happen in the head injury? So this head injury is the number of the killers in the trauma. So this is the number one place in in the mortality. So because of many people die because of the head injury due to RTA, road traffic accidents. So 4 million people experience head trauma annually according to the WHO statistics. So it mentioned more than 4 million people are experiencing the head trauma annually. So in this one, out of the 4 millions, 25% may chance to die because of the severe head injury and severe complications of the brain injury. And also they're going to, in this 4 millions, out of 4 millions, 50% of the deaths from the motor vehicle accidents. So because so many reasons are there for the head injuries, but who already met with the motor vehicle accidents or any road traffic accidents, so those people are going to die. 50% people are going to die because of the severe complications due to head injury. So who are going to prone to more head injuries? So especially for the males, many is a 15 to 25 years of age groups. So if they ride the fast bike riding or car, so those people are going to prone to get the head injuries. And also males and also females, the male percentage going to 50% is more than the female percentage. And infants and also young children also may chance to get. So infants, if anybody fall from the bed or if anybody history of any object fall on the head, also may chance to give the head injury complications. In the elderly, especially who already got more than 70 years of age, so if they having any balance problem and if they having any history of the falls, so because of the balance problem or because of their musculoskeletal abnormalities or vision problem, so and also because of the neurological deficits, they may fall down. It may lead to the head injuries. So coming to the causes of the head injuries. So head injury causes, so many causes are there for the head injury, but only thing is the direct head injury and indirect head injury, and also we have to differentiate separately. In general, head injuries can be divided into two categories based on the cause of them. So is due to because of the blowout to the head, if any direct hit to the bed, or is there any secondary complications? So this and also head injury due to shaking because of the any abnormal movement in the head also may chance to give the like a head injury complications. So what are the mechanisms of the head injuries? So the main this is going to be the other causative factors for the head injuries. The other causative factors are the motor vehicle accidents, any road traffic accidents, especially for the bikes and also in in motor vehicle like in the cars may chance to give the head injuries. In case nowadays, most of the younger generations, they are not using the proper helmets while riding the motorbike. So if any injury, so it may directly hit to the head, may give the severe complications. So that is the main because of the lack of awareness about the helmet, as well as and also in ignorance about the helmet also may chance to get the head injury due to motor vehicle accidents. Or in case of any the car accidents, if they are not wearing properly the seat belt, that also may be one of the causative factor for the head injury. So if they wear the seat belts, or is the car having the like a anti accident like a cushionings, so it may prevent the head injuries. So in a car, if they're having the like airbags, so if they hit anything to any hard object or maybe accident with the other car, so these airbags are going to be opened, may prevent the head injuries. So this is because of the lack of awareness of the seat belt and also helmet, and if the lack of facility in the car, such as like a airbag facilities, so it may give the severe complications. And also other cost factors are falls. So if any object fall on the head, so may chance to get the head injury, or if the person fall from the any height. So in most of the conditions while constructing the any height of the buildings, so may chance to give the head injuries. Or during the construction, if any heavy object fall on the head, also may chance to give the head injury symptoms. And also next one is the physical hazards. So that means if anybody like during the any physically like in the any violations, if they anybody hit on the head with the any iron rod or maybe any hard object use, so it may use the head injuries. And also in case of sports related accidents, in case of especially rugby games, the games and also sports, or maybe in the running, or in case of any like a high jumps and long jumps, so this also may chance to get the head injuries, especially football and also rugby, hockey. So this type of games may chance to get the head injuries, maybe if the missing the like a height of the jump while jumping, or maybe is any twisting activities. So, or maybe is if they're missing like while hitting the like a ball or anything, may chance to get the injury to the head. And also in most cases, the skull will protect from our brain to from the serious injuries. So if in case of, so if we control the like what the activities, so that means we are going to prevent the like a skull injuries and also head injuries. So because of the skull, only we are going to get the most of the severe complications. If no protective organs such as skull, so we may chance to get the severe injuries in many times. So that is the main importance and causative factors of the head injuries.